Neonatal resuscitation are the emergency interventions necessary to revive a newborn who has inadequate breathing or cardiac activity. Any neonate can have breathing difficulties after being born. This is why it's important to anticipate and be prepared for these eventualities. Every newborn deserves the best possible start in life. In the delivery room, things can change in seconds. While the majority of these newborns only require basic care such as drying them or stimulating them, approximately 5 to 10% will require comprehensive resuscitation efforts. So this includes the airway management, ventilation, and chest compressions. In this video, we are going to look at the complete checklist for resuscitation and then learning exactly who may need this resuscitation. You're also supposed to anticipate the risk, prepare the equipment, and have skilled hands ready. Readiness turns potential tragedies into successful outcomes. So let's walk through the checklist and the high-risk situations step by step, because in neonatal resuscitation, preparation and anticipation truly saves lives. Now let's look at the checklist for resuscitation. You must have at least 2 skilled birth attendants being present at every delivery. Then start with the warmth, pre-warmed radiant warmer with temperature probe, then warm sterile towels, newborn hat, plastic bag or cling film for babies less than 32 weeks of gestation, and a thermal mattress for less than 32 weeks gestation as well. Why? Newborns lose heat in seconds very fast and are at risk of hypothermia. Move to A, which is airway. You need a penguin sucker and 6 French or 8 French suction catheter, suction machine which is used to clear the airway instantly. Then you need a laryngoscope with blades, Miller 0, 0, 0 and 1, endotracheal tube sizes 2.5, 3 and 3.5. B is for breathing. Correct size bag valve mask device, 200 to 300 milliliters for neonates less than 5 kg. Different mask sizes, oxygen supply and pulse oximeter. This is where most babies are saved from effective positive pressure ventilation. C is for circulation, IV cannulas, gauges 24 or 26, then syringes 2cc, 5cc or 10cc. Stethoscope to assess heart rate quickly and accurately. ECG leads and monitor, and then you need pulse oximeter and a sensor. D is for drugs, IV epinephrine 0.2 ml per kg of 1 in 10,000 followed by 3 ml of normal saline flash. Then you need a normal saline and blood for transfusion ready. To make 1 in 10,000 adrenaline, take 1 milliliter of 1 in 1,000 adrenaline and add 9 ml of normal saline. The whole mixture will be 10 ml, which is the adrenaline 1 in 10,000. As you have seen, preparation and anticipation are everything, because when the baby has been born and is not breathing, is cyanosis, floppy, there is no time to run and fetch equipment. The checklist and the risk assessment you just saw ensure that the right people, the right equipment, and the right knowledge are already in the room. So this will turn panic into calmness, effective action, and giving every newborn the fighting chance that they deserve. That is the power of being ready. Let's look at the risk factors. We'll begin with the maternal factors like advanced or young maternal age, maternal diabetes or hypertension, antepartum hemorrhage, chorioamnionitis, or premature rupture of membrane. For neonatal factors, we have prematurity, congenital anomalies, multiple gestations, low gestational age, intrauterine growth restriction, poly or oligohydramnios, decreased fetal movements, and previous stillbirth. Delivery complications, we can have malpresentation, abnormal fetal heart rate, delivery via emergency cesarean section. And then for antepartum complications, we have placenta previa or placenta abruption. Good antenatal care and good labor management are not luxuries. They are the foundation of preparedness, because readiness is key in all deliveries.